He dictated that whole letter. I just made it up as I went along. These shocking words weren't from some petty criminal caught in a lie. They came directly from the personal physician of the President of the United States, admitting he fabricated a health assessment for one of the most powerful men on Earth. What else have we not been told? What medical secrets lurk behind the carefully crafted image of Donald Trump, a man whose very brand is built on projections of strength, dominance, and invincibility? Today, we're pulling back the curtain on one of the most closely guarded aspects of American politics, the mysterious medical history of Donald Trump. And what you're about to discover isn't just troubling, it represents a fundamental challenge to democratic transparency. It was June 20th, 2020, Tulsa, Oklahoma. For a fraction of a second, something was wrong. Donald Trump stood rigid behind the podium, his right hand visibly trembling as he lifted a glass of water. But he didn't just use his right hand, he needed both hands to steady the glass. Moments later, as he stepped away, his right foot dragged slightly behind him. The cameras caught everything. America froze alongside him. In that singular moment, a question erupted across the nation. What was happening to the president? This wasn't an isolated incident. Throughout Trump's presidency, strange moments kept accumulating, each one dismissed, explained away, or buried beneath a mountain of tweets and distractions. But when you connect these dots, a disturbing pattern emerges, one of concealment, manipulation, and strategic deception. Long before Trump ever announced his candidacy, he understood something critical about American politics. Image isn't just important, it's everything. And nothing threatens a carefully constructed image more than the unforgiving reality of human frailty. In December 2015, as primary season heated up, Trump's physician released what can only be described as the most hyperbolic medical assessment in presidential history. Dr. Harold Bornstein wrote that Trump would be the healthiest individual ever elected to the presidency, with extraordinary physical strength and stamina. Medical professionals were immediately skeptical. The language was unprofessional, the claims unverifiable, the whole document strangely bombastic. And they were right to question it. 3 years later, Dr. Bornstein confessed the truth. Trump himself had dictated the entire letter. He dictated the whole thing. I just made it up as I went along, Bornstein told CNN. It wasn't a medical assessment, it was medical theater. But why such extreme measures? Why fabricate health records when standard disclosures would suffice? Because for Trump, health isn't just biological, it's political. Every heartbeat, every cholesterol reading, every sign of weakness becomes potential ammunition for opponents. In a world where perception equals reality, even a simple medical fact becomes a liability to control. Nothing demonstrated this obsession with controlling medical narratives more clearly than the November 2019 mystery trip to Walter Reed Medical Center. It was a Saturday afternoon when the presidential motorcade suddenly departed the White House. No advance notice, no press pool, no explanation until hours later, when White House officials claimed it was simply Trump getting an early start on his annual physical, an explanation that defied both precedent and common sense. Former administration officials later revealed a more troubling possibility. Trump had refused anesthesia for what may have been a serious procedure because he didn't want to temporarily transfer presidential power to Vice President Pence, even for a matter of hours. If true, this wasn't just about privacy, it was about an absolute unwillingness to relinquish control under any circumstances. The public will likely never know what actually happened that day, and that's precisely the problem. But nothing tested Trump's health narrative more severely than his October 2020 COVID diagnosis. A crisis that transformed from medical emergency to political theater in a matter of days. Let's be absolutely clear about what happened. At the height of a global pandemic that had already killed over 200,000 Americans, the president contracted the very virus he had repeatedly downplayed. Within hours, his oxygen levels dropped dangerously, not once but twice, requiring supplemental oxygen. His medical team administered an extraordinary combination of treatments, typically reserved for only the most severe cases. Experimental monoclonal antibodies that fewer than 10 people in the country had received outside clinical trials, powerful steroids usually given only to patients in respiratory distress, and remdesivir, an antiviral with limited availability. This wasn't standard care. This was emergency intervention for a patient in serious condition. Yet just days later, Trump staged what can only be described as a medical publicity stunt. Against medical advice, he demanded a motorcade to wave at supporters outside Walter Reed, forcing Secret Service agents into a hermetically sealed vehicle with a COVID-positive patient, One former agent called it an irresponsible PR stunt that put lives at risk. But the true spectacle came when Trump returned to the White House. Standing on the Truman balcony, he dramatically removed his mask before the cameras. Still infectious, still shedding virus, and gave a salute. The message was unmistakable. Even COVID couldn't weaken him. Behind the scenes, however, White House staffers reported a different reality. Trump was struggling to breathe. His makeup couldn't conceal his pallor. And in the days that followed, at least a dozen White House officials who had contact with Trump tested positive themselves. The gulf between public image and private reality had never been wider. But COVID wasn't the only health mystery plaguing Trump's presidency. There was the strange incident at West Point in June 2020, where Trump's halting, uncertain descent down a ramp triggered widespread speculation. Rather than acknowledging any difficulty, Trump insisted the ramp was very long and steep, had no handrail, and most importantly, was very slippery. Except it wasn't raining, and video showed others walking down with no trouble. Then there was the unexplained emergency room visit in 2019, the strange, unannounced trip to Walter Reed that was never fully explained to the public. The moments of slurred speech during addresses that sparked public speculation, though officially dismissed as nothing concerning. Each incident in isolation could be dismissed. Together, they form a troubling mosaic of concealment. Perhaps most revealing is Trump's fixation on cognitive testing. During a July 2020 interview, Trump boasted repeatedly about acing the Montreal Cognitive Assessment, a simple screening tool designed to detect early dementia, not measure intelligence. Person, woman, man, camera, TV, he recited, claiming doctors were very surprised at his performance. What Trump didn't seem to understand, or deliberately misrepresented, is that the test isn't designed to be difficult for people without cognitive impairment. It's like bragging about passing a sobriety test when you haven't been drinking. The only surprising outcome would be failure. Why would a sitting president feel compelled to repeatedly bring up a basic cognitive screening test unless cognitive decline had become an active concern behind closed doors? And what about Trump's physical condition? Official medical reports placed Trump at 6 feet 3 inches and 243 pounds during his presidency, technically obese under CDC guidelines, but only barely. Yet photographs of Trump standing next to individuals of known height, like 6 feet 1 inch Justin Trudeau or 6 feet 2 inches Barack Obama, tell a different story. Height doesn't lie. Weight can be manipulated on paper. Former White House staffers have described extraordinary measures taken to conceal any signs of physical limitation. Carefully planned walking routes with strategically placed handrails, camera angles restricted to hide labored breathing or unsteady gaits, and event schedules designed to minimize physical exertion. Trump's diet became legendary among White House staff. According to former campaign manager Corey Lewandowski, a typical Trump meal consisted of 2 Big Macs, 2 Filet-O-Fish, and a chocolate malted shake, all in one sitting. He reportedly consumed 12 Diet Cokes daily. When staff attempted to incorporate healthier options, they were firmly rebuffed. Chris Christie revealed in his book, Let Me Finish, that attempts to improve Trump's eating habits went nowhere. He'd order a burger, and I'd get a salad, and he'd look at me like I'd just ordered poison. This wasn't just personal preference. It was defiance of medical advice. What emerges is a portrait of a man pathologically resistant to acknowledging any physical limitation or following any medical guidance that might suggest weakness. And around him, a system of enablers willing to maintain the facade at all costs. Dr. Ronnie Jackson, the White House physician who gave Trump glowing health assessments, later ran for Congress as an outspoken Trump supporter, raising serious questions about his medical objectivity. An internal Pentagon report even accused Jackson of misconduct during his White House tenure, including improperly dispensing medications and creating a hostile work environment. The relationship between Trump and his medical team wasn't just doctor-patient, it was political symbiosis. So why should any of this matter to you? Because presidential health isn't just a personal issue, it's a national security concern. When a president conceals health issues, they're not just lying to the public. They're potentially compromising their ability to fulfill their constitutional duties. A president experiencing cognitive fluctuations, physical limitations, or medication side effects is a president potentially making impaired decisions affecting millions of lives. This isn't about politics, it's about fundamental transparency. Previous presidents from both parties, Obama, Bush, Clinton, Reagan, released detailed medical information. John McCain, at age 71, allowed reporters 3 hours with his complete medical records and access to his physicians. The precedent of disclosure exists for a reason. By 2024, as Trump sought to reclaim the presidency at age 77, these questions had only intensified. Verbal slips, incoherent tangents, and physical unsteadiness became more frequent on the campaign trail. Yet instead of transparency, the public received more carefully staged appearances and selective disclosure. Here's the uncomfortable question we must confront. If a president will lie about something as verifiable as their own health, what else are they willing to conceal? The most concerning aspect isn't the potential health issues themselves, it's the systematic deception surrounding them. It's the willingness to fabricate documents, pressure medical professionals, and create elaborate cover stories rather than acknowledge human frailty. Every American deserves to know whether the person with their finger on the nuclear button is physically and mentally fit for the job. Every voter deserves accurate information about the humans they're electing, not carefully manufactured PR images designed to project superhuman vitality. The Trump health saga isn't just about cholesterol numbers or COVID treatments. It's about the dangerous intersection of ego, power, and deception. It's about a fundamental challenge to democratic accountability. And it forces us to ask, in a system where even medical truth becomes negotiable, what happens to the very concept of objective reality? If we can't trust basic facts about a president's physical condition, facts that could be verified with simple tests, how can we trust anything we're told about more complex issues like national security, economic policy, or international relations? The most insidious effect of Trump's health deceptions isn't just the specific information withheld. It's the normalization of institutional lying. It's the tacit acceptance that presidents can create their own medical reality, and we, the public, have no right to question it. This isn't normal. It has never been normal, and we should never allow it to become normal. Because once we surrender the expectation of basic honesty from our leaders, even on matters as straightforward as height, weight, or medical test results, we've surrendered something fundamental to democracy itself. The right to make informed decisions based on verifiable facts. So the next time you see a president taking extraordinary measures to control their medical narrative, whether it's dictating their own health letters, staging dramatic recoveries, or attacking physicians who question their accounts, remember what's really at stake. It's not just about one man's health, it's about our collective right to truth.